Afternoon to all. I'm Dr. Nikita, fellow Cornea and Phaco-Refractive M.M Joshi Eye Institute, Hubli, and I welcome you all to yet another session of iTalk. So iTalk, as we all know, is an initiative by M.M Joshi Eye Institute and group of hospitals to create awareness amongst general public regarding common eye diseases. So in today's discussion, we'll be providing you with basic eye care tips and advices, and we have with us our expert faculty, Dr. Abhishek Bawdekar, sir. He is consultant cornea, uveitis and ocular immunology, M.M Joshi Eye Institute, Hubli. Good afternoon, sir. Welcome to iTalk.
Good afternoon, everybody. And on behalf of the Department of Cornea, M.M Joshi Eye Institute, I hope to take you and provide you with the eye care tips during the course of this conversation.
Okay, so without much delay, we'll start with this session. So everyone wants to know, sir, when should one go for a routine eye examination? At what age and why should one go with the routine eye examination?
So, as we all know, and I would be restricting myself to the adult population, every adult should undergo a routine eye evaluation. Okay, so I would just share my presentation. So generally, when we see adults from the age of 18 to the age of 40, the adult population, the young adults, so-called young adults below the age of 40, they generally have stability in their eye vision, and their eye health generally is more or less stable from the age of 20 to 40. This is the critical time for this population to establish good eye health habits so that they can enjoy a better eye vision and better quality of vision for the further period of time. So between the age of 18 to 40, I would stress that people who are having no glasses or any other no glasses can have a healthcare checkup or eye care checkup once a year. But at least people who are having refractive errors should get it more often. But above the age of 40, this is the time when we see that most of the changes happen. So this is a transient phase from the age of 40 onwards when we step into the middle age. During this time, the most common change which can happen with the people is that they do notice some amount of difficulty for concentrating near vision. It may be as simple as seeing the mobile phones, or maybe doing, especially if the women are cleaning the rice, they feel that it is more difficult and they would like to see it at a distance. This condition is called as a presbyopia. Generally, people in their late 30s or early 40s will develop this. Why is this significant? It is significant because if you don't correct it, then preferably your working distance tends to go more and more further. And if you try to bring things near and try to concentrate, then you tend to develop eye strain, you could develop tired eyes, and also you can develop some amount of headaches. So at the age of 40, it is essential for every individual to get a comprehensive baseline eye examination, irrespective of your symptoms. Why? This is because an ophthalmologist, when he examines you, he can pick up signs of eye conditions like cataract, glaucoma, diabetic retinopathy, and age-related macular degeneration. So when you develop 40, you also notice that there are a lot of individuals who tell that they are also having high sugars, high blood pressures. And these are the conditions which also have a bearing on the eye. We have to remember that the eye is a part of the body, and any condition which can affect the body also takes its toll on the eye. So these are the common conditions I would just like to enumerate, which an ophthalmologist would be very much interested in seeing, like cataract, glaucoma, which means that there is an increase in the pressures of the eye, signs of diabetic retinopathy, age-related macular degeneration, and dry eyes. Why are these important? These are very important because these are all causes which give rise to avoidable blindness and for whom we have simple solutions. Many a times, people who are having cataract, they go around with their life till they develop a long-standing or diminution of vision, which makes them difficult to even work routinely. It is not necessary for you to suffer till that. In case of glaucoma or this condition wherein there is an elevation or an increase in the eye pressure, most of the times when you have glaucoma or when you get screened for glaucoma, with the means of simple medicines or surgery, you can have healthy vision till the end of your life. Diabetic retinopathy. I would like to stress on this because India, as you all know, is the diabetic capital of the world. And most of us do have one or the other relative who is having diabetic. Diabetic retinopathy is a kind of microvascular complication of long-standing diabetes. The problem being that the earlier you detect the diabetes, the earlier you go for a retinal examination. Many a times we neglect it, and until it is very late, we do not check for the diabetes, we don't check for the loss of vision. So diabetic retinopathy, if you have checked earlier, you can make sure that the individual will have healthy eyes and healthy vision for a long time. Age-related macular degeneration. This is another condition which is affecting the retina, wherein the patient will develop signs where he is not able to identify faces and able to read books. When identified early, we do have intravitreal injections for making sure that one doesn't suffer significant visual loss. And lastly, the dry eyes. Today, in an era when a lot of women, especially women, are working out and doing their professional commitments and satisfaction, post-menopausal women, they do have a lot of incidents of dry eyes after the age of 40, 45. And this is one of those conditions which make them severely incapacitated for doing their normal work. And these are the conditions which, with a simple evaluation, simple dietic control, and simple eye drops can give them a lot of relief so that they can work uninhibited in their professional work. So the other thing what we should know is after the age of 40 is during this time between 20 to 40 years is what we do now between this period makes us prone for the effects of it in the later. So during this point of time, people should make sure that they control their weight so that they do not have obesity. They can control their blood sugar so they do not suffer from diabetic retinopathy or diabetes, blood pressure, and cholesterol. Why this is important is most of the times when this come for a simple eye examination, the ophthalmologist has the privilege to see most of these conditions causing complications at the earliest. And they can guide the patient that you have this condition and you need to take referral. We see that a lot of diabetics are first diagnosed after having a loss of vision. A lot of fresh people are diagnosed with hypertensive retinopathy after they get a routine eye checkup done. So we need to know the important part of getting the eye evaluation is that when you get it, sometimes you can pick up all these avoidable causes of blindness early.
So when should one go for an eye checkup immediately, sir? What are the emergency conditions when one should consult an ophthalmologist?
So I would put it like this, that when do you want to seek eye checkup immediately or a medical checkup from an ophthalmologist? So there are two major important parts. One, whenever you are suspecting an eye infection or when you are suspecting an eye injury. There are people who do have some eye infection like viral keratitis or a bacterial or a fungal keratitis. Now, most of the times there are common symptoms. Number one being pain, number 2 being watering, number 3 being redness, and number 4 being blurring of vision. Many a times, an early attention to this infection or early evaluation makes it very easy for us to. Most of the times what happens is people, when they do have some redness or irritation, they go to the local pharmacist and tend to use or abuse local eye drops. And these eye drops, unfortunately, like steroids, which are available over the counter, tend to complicate the condition. And hence, I would say that if anybody is having any infection or suspecting an infection, 4 important things, signs which I would say is, if you are having any pain, if you are having any redness, if you are having watering, and there is a blurring of vision, just consult an ophthalmologist at the earliest. The second thing is injury. We see that this part of Karnataka being a agriculture-based society and industry-based society, a lot of people when they are working in the fields get injured with some amount of vegetative matter, like maybe a sugar cane leaf, or maybe working in the farm, they get injured by some haystack or any instruments like sickle. Uh, when you get that, you also tend to have a similar loss of vision. At this point of time, it is very important to get a evaluation done immediately, because an early intervention at an early stage can help save and have functional vision for us. Until once the eye is injured, then definitely there is a chance for the external infectious agents to get into an entry into the eye, which can complicate things. So it is important that whenever you sustain an eye injury, to meet the ophthalmologist at the earliest.
So what are the tips for preventing eye injuries, sir?
So eye injuries can happen at any age. We see a lot of children having eye injuries, lot of young adults who are working in the fields and in the industrial sectors having eye injuries. Now, number 1 would be that the access to devices or instruments which cause injury. A simple wooden stick, a simple sickle, which is there available in most of the houses, is a major source of injury. A simple leaf or a simple like thorns, which or if they are working in the fields, injury to the eye, especially when you are harvesting the harvest season, you do develop some amount of eye injuries. Now, why it is very important is, like all these injuries, whether they happen in and around the house or at work, they can be protected by a simple eye protective gear. So we see a lot of patients, whose injuries could have been prevented had they used a simple protective glasses. So hence I would stress that in case of at home, make sure that you are having sharp instruments or sharp equipments away. In addition, I would say is that a lot of people who eat tuna or limestone, especially with tobacco, this is a major source of eye injury for the children. When this tuna or limestone goes into the eye, it gives rise to a chemical injury and can give rise to permanent blindness. Simple measure is to keep this thing away from the reach of the children. In case of young adults, when they are working in the fields or in the industrial sector, wearing protective CR39 glasses, which can prevent at least 90% of the injuries.
Are there any other conditions which require immediate attention?
So with age, the other changes which can at any age, if an individual develops a sudden change in the vision, or if there is any blurring of vision, then he should seek an appointment with an ophthalmologist. If he has developed any floaters or flashes. Now, this is one of the most commonly seen things, like floaters and flashes. What probably people pick up is they are seeing something moving around when they are seeing in a plain background, or they are feeling something like a light going around. Now, this could be a sign of an early diabetic retinopathy or a posterior vitreous detachment. That should be given importance, and they need to get evaluated at the earliest with a retina person. Sometimes diabetic patients develop double vision. So what happens is if a person is a hypertensive or a diabetic, they may develop some focal neurological deficits because of bleeding in the brain. And hence some of the nerves which are controlling the eye movements can get affected. The time they develop this double vision, or you can probably see that the eye is not seeing, both the eyes are not seeing in the same line. One eye is probably deviated and they have to close one eye to concentrate. Lastly, at any age, if there is a sudden loss of vision, and hence I would stress that at least once a month or so, you have to keep one eye closed and check the vision with the other eye, so that you know whether you are able to see prior, as you were seeing earlier, or if you are noticing any diminution or sudden loss of vision. So any change in these four parameters, better to get evaluated.
Right, sir. Sir, in COVID era, as people have shifted towards work from home, there is another epidemic of digital eye strain. So, what are the symptoms and how to go ahead with preventing these symptoms?
So, digital eye strain, I would be previously sometimes called as a computer vision syndrome, probably prior to the pre-corona era. Now, probably it is better referred to as digital eye strain, because during the corona era, we have seen a lot of students shifting to mobile phone and tablets for their online classes. A lot of professionals, especially software professionals, moving to their work from home. So what happens with this is that when you're going to see on the screen for a long period of time, you develop some uncomfortable effects. This can happen at any age. It could happen in children because of the prolonged online classes, or young adults because of the prolonged online classes for college, and also for engineers for work from home. Now they do have common features, like they would complain of a blurring of the vision after prolonged working. They may feel that the eye is tired, some amount of dryness, wherein they feel that they need to close the eye. And if they are closing the eye, they may also have this watering and the stinging sensation. These four features are very common in digital eye strain. And when they do happen, it is important for you to get your eye checked. Now, why this digital eye strain happens? Now, normally when we are working without any without any focus or so, we keep blinking our eye. Whenever we are blinking our eye, the tear film which is present in the eye, it spreads evenly across the eye and hence makes it more wet. So we normally blink about 15 to 18 times per minute. But when you are focused, say for example, when you're looking at a screen and you are fully focused and concentrating on it, this frequency of blinking, it comes down. It can be as low as less than 5 per minute. So when this blinking comes down, whatever the tear film is there on the cornea, it tends to get dried. And then when you try to blink, then it becomes unstable. And then you feel that features suggestive of digital eye strain. Now, the simple remedies for this digital eye strain is you should just blink. Make a conscious effort to blink. Every time when you're working, keep blinking your eyes. Keep making sure that the tear film is spreading evenly so that you don't have that difficulty. In case you have more symptoms, then you could use a simple lubricating eye drop, which is nothing but an artificial tear substitute. You could use it, especially preservative-free eye drops, as and when required and as frequently as required. The other thing which you should remember is 20-20-20 rule. So we know 20-20 cricket, but for the digital eye strain, you need to know something much more. That is another 20. So what does this mean? Is that every 20 minutes, you should take time off your screen and look at an object which is at least 20 feet away from you, and try to see there for about 20 seconds. So what it does is it gives you some amount of relaxation to the ciliary muscles of the eye. These ciliary muscles are the ones which help in accommodating and focusing when you are concentrating. So if you do this, you tend to develop a lot of comfort. Apart from this, few other things what you can do to prevent digital eye strain would be adjusting the contrast and the brightness of your screen. So you also tend to reduce the glare. Now, how you can reduce the glare and adjust the, of course, adjusting the brightness and contrast, everybody knows. But by reducing the glare is that when you're working on the digital screen, try to make sure that there is some amount of ambient light. Watching a mobile in darkness or seeing a laptop screen in darkness tends to have a lot more glare onto your cornea. Thirdly, how you work at the computer. That is the simple ergonomics. So you should make sure that the computer is, or the laptop screen is at least about 30 centimeters away, and you should be pretty much relaxed when you are working. Also, you should make sure that you are looking down at it or at the same eye level or looking slightly down below your eye level. You should not look above or away or at an angle to the screen. And lastly, I think is that everybody wants to be in an AC room or having a fan. So what happens is our tears, they get dried in the AC vent or the fan is blowing into their eye. So preferably try to make sure that your position on the screen is such that this wind or this air is coming from behind, so that the humidity and the dryness of the eyes, is prevented.
Okay. Sir, these blue light blocking glasses are available in the market. Are they of any use?
I think this is one of the gimmicks which are marketing gimmicks. But if you just take care of the glare and contrast and position, you don't need any blue light. There is no scientific basis that blue light will help prevent eye strain. And secondly, we should know that in today's world, everybody is seeing at an LED screen, not at a CRT screen as seen earlier. So LED screen has very limited emission of light, and it doesn't give any rise to discomfort because of blue light. I think that is one of the overrated things regarding the blue light blocking, but that doesn't have any scientific basis.
Okay. Thank you, sir. Sir, what are the take-home messages from your side?
So, as we are talking about this, we need to remember that when we see young adults and individuals between the age of 20 to 40 and maybe 40 to 50, all of us are very active in our work, in our homes, and professionally and personally. We don't realize that we will grow old with time, and this is the time we should take investing in our health, both the body's health and the eye health. This is important because we can have, if we take care from the ages of 20 to 40, we can have a better 40 to 40 plus or 60 plus eye health. So what can we take care of? What are the things we can do so that we can take care of the eye today for a healthy vision tomorrow? Number one, I would say that you should know your family history, which has a big role in vision. If you have a parent who has a diabetes or hypertension, you do have a genetic tendency to develop it also. So if you know that your family history of diabetes, hypertension is there, make sure that you check yourself. Secondly, as you grow old, watch your children. When the children try to see books also at a very closer distance, you know something is wrong. Or if they are constantly falling and not able to see what is there on the board, you know something is wrong. So you need to check that. Thirdly, the eye is part of the body. So whatever nutrition we eat is also going to the eye. So healthy food and exercise is important. For people who are smokers, it is important that they stop or avoid smoking completely. If you know that you are a diabetic or a hypertensive or having some amount of cholesterol, it is important that you keep it under control, because whatever affects your body will affect your eye. People who are involved in outside work should make sure that they wear sunglasses or protective glasses when they are outside. People who are involved in agriculture, if they do not have access to sunglasses, at least make sure that they wear a cap which is covering the front of the face, so that they are avoiding sunlight exposure into their eyes. Professionals who are working on the screen should make sure that they minimize their eye strain at work by following the 20-20-20 rule. People who are wearing contact lens should maintain the discipline for the contact lens. Now, young college goers would like to share makeup. So I would say that you should not share makeup, have your own individual makeup kit, and you should avoid sharing it because it can tend to spread eye infections. More importantly, try to pay close attention to changes in the vision. Suppose you are not comfortable with vision which were you were previously comfortable, make sure you get yourself evaluated. We have this feeling that vision tends to get reduced with age, but it is not like that. There are times when the vision may not be getting reduced with age, it may be before that, and hence it is important that you make sure that any visual change or any visual loss, irrespective of the age, is addressed.
So we have few questions, sir, from our viewers.
Okay.
We're taking up those questions as well. So the first one is, I'm having high spherical number. My age is 35 years. What is the best solution to get rid of the glasses?
Now, first of all, I would suggest that when you are having a high spherical number, it means that you are a myopic individual. Before going for the solution, you first need to get your eye checked for the degree of myopia you are having. Now, we don't know whether it is -1, -2, or -10 or -50. So we generally do a refractive surgery workup for these individuals. And at the age of 35 or so, you are pretty much, if your eye condition and your eye health is good, you are pretty much entitled to benefit from one of the refractive surgery solutions which are available. If your eye number is among the lower, less than 5 or so, and you are having a good corneal thickness, then you could probably benefit with refractive laser vision correction. If your eye number is more than that, then we do have phakic intraocular lenses like ICL and IPCL, which can address that solution. So these two things you should know. Apart from this, if you don't want to undergo any surgery, you always have to wear glasses, or you could also consider using contact lenses. Irrespective of the refractive correction, all myopes, they need to undergo a dilated fundus evaluation to see for any signs of myopic retinal changes, which are important because they can lead to problems associated with retinal detachment later. And hence it is very important for you to get checked for the retina along with the refractive workup.
Thank you, sir. Sir, do people still need glasses after Lasik surgery?
So the main purpose of LASIK surgery is to correct distance vision. So between the age group of 20 to 40 years, depending upon the degree of myopia which has been corrected, you do not require a eyeglass for distance. Almost around 90 to 95% of the 95% I would say of the individuals don't require any glasses for their normal day-to-day work. Very rarely, if the eye thickness is not permitting, or if the patient has some other issues, they may need some glasses about less than 1 diopter or so, but that is not necessary. This is till the age of 40. Now, after 40, your eye will heal or behave like a normal eye. So after the age of 40, you will still you need glasses for reading and for presbyopia. So post LASIK surgery, depending upon your age, you don't require glasses for the distance, but after the age of 40, you would require some for near vision. One more point I would like to add is, if you are an individual who has undergone a LASIK surgery and you are realizing that compared to previous, you are now requiring glasses and that glass number is probably constantly changing, then it is important for you to get your cornea checked again, because this could be a sign of a post-LASIK ectasia, which can happen in very rare individuals whose numbers has been corrected whose number has been corrected who are being prone for some ectasia.
Sir, what is post-Lasik ectasia in general public term, if you describe it?
So here at M.M Joshi Eye Institute, when we plan for a patient to undergo a LASIK surgery, we lay a lot of emphasis on the workup for the cornea. So it is like if the cornea is very strong, then we want to go ahead with the surgery because the safety of the surgery is important. Many a times people want to get their eye number changed, and sometimes it is done at the when we compromise the stability or the safety of the surgery. Then after LASIK surgery, there may be a development of a weakness in the cornea. Because of this weakness, the cornea tends to bulge forward more than what is required. And that time they would notice that number one, there is a diminution of the vision. Number two, they may see ghost images, so that the images are not, if you see one light, they may see a shadowing effect of the light happening next to each other. And number three, they can see a noticeable drop in the vision. So this is a condition called as post-LASIK ectasia. And there are solutions for that, where we can go ahead with contact lenses or collagen cross-linking to prevent further. But I would stress that it is a very rare complication of the LASIK surgery, and it is the risk of developing a post-LASIK ectasia is, if done in a very scientific way, is less than the chance of you getting hit on the road by an accident. So if you are safe, if you have done a good pre-LASIK evaluation, the risk of post-LASIK ectasia is almost negligent.
Thank you, sir. Sir, what is C3R?
Okay, so C3R is collagen cross-linking. So it is one of the treatment which we do to strengthen a weak cornea. So many a times in the cornea, especially people who are having history of keratoconus or post-LASIK ectasia, the cornea tends to become a little bit soft. And with this treatment, wherein we use a chemical agent called as riboflavin to and ultraviolet light to increase the number of the bonds, collagen bonds into the cornea, we make it more stronger. This treatment is generally done for two common conditions, that is keratoconus, which happens in the age group of 15 to 25 years more commonly, and post-LASIK ectasia in individuals who have undergone LASIK. So it is a very simple procedure. It is done in the operation theatre, wherein for half an hour or so the chemical agent, that is the riboflavin, is put. The riboflavin is one of the essential elements which we require in a diet. The same element we are putting into the cornea and making it more strong. We increase the number of bonds so that we tend to make the cornea much more strong or much more tighter and less prone to bending.
Thank you, sir. There's one question. My mother recently she's getting halos and glares. What may be the problem?
I think first I like to ask the individual is, did you get an eye examination? Okay, if your mother is getting halos and glare, there could be two important causes. Number one, she is getting old and she is developing cataract. Number two, very rarely she could also have an undiagnosed glaucoma, wherein the pressure of the eye is becoming more, and then whatever light is seeing, it is becoming more traumatic for her. So these two conditions, and both of them can be detected by a simple eye examination with an ophthalmologist.
Another question. My eyes get red frequently. How can I prevent this?
I think depending upon the age group, why the eyes are getting red frequently. If it is a younger school-going kid who is playing onto the ground, he is having more amount of dust exposure, the eye is getting red, then it could be a case of allergy, simple allergy. Sometimes if the eye is getting red because of non-exposure to dust or allergy, then it could be also a sign of uveitis or glaucoma. So if you are getting an eye redness, a redness alone will not be a problem. But if you are having issues like blurring of vision or any pain in the eye, then or itching, simple itching, it means that you might be having one of the commonly conditions like an allergic eye disease or an uveitis, which means an inflammation of the eye or swelling inside the eye, or you could have an elevated intraocular pressure or IOP, that is glaucoma. So if your eyes are getting frequently red, then these are the common things. The fourth condition which I would say is that if your eyes are getting red frequently and it is because of you are rubbing your eye, then you might be having a refractive error or you might be having glasses and you have not taken a solution for that. So get your glass checked, and if you do have a glass prescription, then you make sure that you wear the glass prescription. And if you are having any allergy, then you can consult the concerned ophthalmologist to take care of that.
Thank you, sir. There's one more question. What is the advantage of Lasik over contact lenses? As I'm already using contact lens, can I go for Lasik surgery at the age of 25?
You could very well undergo a LASIK surgery after prior consultation with the ophthalmologist or the cornea and refractive specialist. If you are already using contact lenses, then it is important for you to make sure that you are wearing the correct contact lenses. Your refractive error has been checked with age, and until you undergo the LASIK evaluation or the pre-LASIK evaluation, we would not know whether you are a suitable candidate for LASIK or not. But once you undergo the pre-LASIK evaluation, we will get to know a lot more things regarding your suitability. And if you are suitable, then there is absolutely no problem in you undergoing the surgery.
Thank you, sir.
I would ask that individual that if you are using a contact lens and you are using glasses and you intend to undergo a LASIK evaluation, it is important that you can visit us so that you can undergo the complete pre-LASIK evaluation, wherein we check your vision, we also check the cornea strength and the retina also. And depending upon the suitability, you should not have any difficulty. We have enough solutions to make sure you don't need to wear glasses.
So one last question, sir. Is there any need of glasses after cataract surgery?
So I would put it like this. So were you wearing what was the purpose of wearing glasses before cataract surgery? If you are wearing glasses for reading after cataract surgery, then you could use one of our more advanced intraocular lenses, like the multifocal lenses which are available and extended depth of vision lenses which are available, which up to 95 to 98%, which mimics a normal God-given lens. So up till 95 to 99%, you don't need to wear glasses for near vision, intermediate vision, and distant vision if you go for extended depth of focus or a multifocal lens. However, if you have undergone a cataract surgery with a monofocal lens, then you may not require glasses for distance, but you would require glasses for reading. The dependency of monofocal lenses, the only thing about monofocal lenses is it mimics your eye at the age of 40, after the age of 40. So after the age of 40, the only purpose for your glasses would be for reading. So after a monofocal cataract surgery, you only require glasses for reading.
Thank you, sir. So this is all we have from our viewers. I think we have reached the end of the session. Anything else you'd like to suggest to our viewers, sir?
What I would like to suggest is that eye health is an important part of your life. All the viewers would probably be using some amount of mode of transportation like bikes or scooty or so. You tend to take care of the scooty more than you take care of the eyes. Everybody gets their vehicles serviced maybe twice or thrice a year. All what I would suggest is your eyes are much more important than them. If not twice a year, at least once a year, you go and get your eyes evaluated. Because after 5 years, your vehicle is not going to be with you. You can change your vehicle. But if you are not going to take care of your eyes and have regular checkup then after 10 years, you would have some difficulty. So what you take care of your eyes is and your body is much more important than what you would like to take care of your vehicles or your mobile phones. That's all I would like to say.
Thank you, sir. Thank you so much for joining us on Sunday morning. Thank you, all of you, for joining on the in iTalk. I think this is the end of the session now. And
Thank you, Nikita, and thank you all the viewers.